Welcome to the side event for the future of mental health. The good mental health is the foundation of well-being. Mental health enables people to fulfill their potential, remain resilient amid adversity, be productive, and form meaningful relationship with their community. Mental health is necessary for society to thrive and function effectively. It is essential to build up and harnessing social capital, fostering a shared sense of purpose, empowering collective action for sustainable development. Sounds very obvious statement, but I was wondering if our approach to mental health had truly considered those perspectives before COVID-19. The pandemic has impacted the lives of people in many ways in terms of connection, safety, freedom of movement, and livelihoods. It has brought into sharper focus of pre-existing mental health gaps and inequities, and it has particularly affected the mental health of children. COVID-19 has shown us that the mental health is about everyone's well-being. Actually, before COVID-19, several member states, including New Zealand, Australia, and the Republic of Korea, spoke about the need to change our approach to mental health and requested WHO to think about how we can do things differently. And over the past year, while responding to the psychosocial impact of COVID-19, WHO has also been shaping the agenda for the future of mental health through a regional forum with the next generation of mental health professionals, expert consultations on the future of mental health, and repeated discussion with the several member states. And the forthcoming series of consultations with our member states. And what we have confirmed is that everybody agrees that we need a new way of working, shifting towards more holistic approach and a transformative environment that promotes well-being on a much broader scale. The key question now is how to move from the status quo towards such a future. The team is going to report about the different discussions that we've had, and I'm looking forward to hearing more during this side event about actions that we can make to turn this vision of the future into reality. Thank you very much.
Thank you very much to Dr. Takeshi Kasai for your comments there. And as regional director and as the person that you are for leading mental health, not only in response to COVID-19, but I think in helping us realize that even in war, and this is a health war and a social war that we're embedded in, everyday mundane needs continue. And this is not mundane at all, but mental health has become, once again, a human touchstone that has brought us all together. So Dr. Kasai, thank you very much for sharing a bit of your vision, how that framework could repivot our understanding and our approaches. And more importantly, I think not only to secure the health of the region, but to secure the safety of the people who live here. What are the future challenges that we're going to face? And more importantly, how can we infuse the new ways of thinking and the new ways of working that you briefly outlined there to our current approach on mental health? Well, of course, as we all know, the WHO posed these questions to the region's mental health experts and convened a consultation earlier this year, not only among clinicians, but also researchers, program managers, scientists, and advocates who represent a very wide range of disciplines. And many of them are here with us today at this regional committee meeting hosted out of Himeji in Japan. I wish we could all be there with you in Japan. But to share some of the key reflections from that meeting and to introduce us to Koki, a young mental health leader from Japan who's also joining us for the panel discussion to follow, may I now call on WHO Senior Consultant for Mental Health and Substance Use, Dr. Eiichi Seki. Dr. Seki, please.
Thank you, James. During the panel discussion on primary health care and other agenda items during this RCM, some shortfalls in the conventional approach to health were noted, including general orientation towards illness over well-being, overemphasis on treatment in medical facilities instead of mobilizing community resources for prevention and primary care, and insufficient coordination among sectors beyond health in addressing determinants of health. All of these apply to mental health as well. Throughout our experiences of combating COVID-19, the importance of mental health has been recognized far much more than ever. And now, mental health is for everybody. As Honorable Minister of Malaysia and Honorable Minister of Brunei Darussalam referred to during this RCM, and as Dr. Kasai made further remarks earlier, it is time for addressing mental health as an essential part of all health efforts and doing it differently than the conventional approaches. On this matter, with the leadership of R.D. Kasai, discussions and informal consultations have been made since the beginning of last year, including those with Mongolia, Tonga, and Philippines, as well as dialogues with young generation mental health professionals in the region as a joint effort with Keio University, Japan, and as a milestone event, an expert consultation on the future of mental health in this region was held in July this year, with the participation of experts representing various mental health-related disciplines from Australia, China, Fiji, Japan, New Zealand, Philippines, Republic of Korea, and Vietnam. The framing of thoughts for exploring and co-creating our new approach for mental health, consisting of 3 pillars, have come out as a result of the consultation, and it is used in today's panel discussion as well. These 3 pillars are, first, refocusing towards well-being and reaching the unreached with a solution generated from the ground up to match the needs of communities. And second, transforming mental health care with the optimal mix of services, building up human resources and improving quality. And lastly, embedding mental health into daily life with interventions across the life course and promote mental health beyond the health sector. We are now to show a video on the activities of Anata no Ibasho in Japanese, or A Place for You in English, founded by Mr. Koki Ozora, a young leader from Japan, in addressing the issues of loneliness and isolation. Koki's activities are certainly driven by his unique insight and capabilities for action, but the issue he is addressing should be common to various other settings. His activities are grounded by his own lived experience, based on a ground-up approach, and promoted through the use of technology and mobilization of mindful volunteers. In various corners of the region, there may exist potential leaders with a mindset similar to Koki's, and this is why we, the Secretariat, wanted to bring Koki's activities to the attention of the distinguished delegates. With this introductory remark, I would like to invite you all to listen to Koki's story. Thank you.
あの時私は孤独でした。高校時代の私は自ら命を絶つことも考え、一人苦しんでいました。後に私は信頼できる恩師に奇跡的に出会えたことで問題を乗り越えられました。問題を抱えた人が奇跡や運や偶然でしか僕にとっての先生のような頼れる人と出会えないというそういう環境はおかしい。問題を抱えた人が確実に頼れる人にアクセスできるような仕組みを作り、望まない孤独を抱えることがないように我々はあなたの居場所というのを立ち上げました。あなたの居場所は24時間365日 誰でも無料匿名で利用できるチャット相談の窓口になります。私たちにアクセスをしてくださる方のほとんどが29歳以下の子供や若者たちになります。メンタルヘルスに悩む多くの人に共通している課題は孤独を抱えているということです。友達や家族は近くにいるけど相談できない、頼りたくても頼れないという状況にあります。私たちのミッションはこうした状況をなくすこと、つまり望まない孤独をなくすということになります。私たちはまずは話を聞いて、そして自分の気持ちに寄り添ってもらえる場所がある、自分は一人ではないっていうふうに感じてもらうことが大切だというふうに考えています。間違いなくこのコロナによって人々のメンタルヘルスというのは大きな影響を受けたと思います。実際にデータを見てみると顕著で、特に子供や若者、そして女性が影響を受けています。ただパンデミックによってメンタルヘルスに対する考え方というのは大きく変わったと思います。例えば、このパンデミックの中で、多くの人がメンタルヘルスの問題を抱えているということは、社会に広く知られるようになってきました。僕自身はやっぱり望まない孤独をなくしたいと思って今この活動をしていて、相談師さんと日々接している中で、その相談師さんが抱える本当に苦しみというのがよくわかるんですよね。自分自身もそうだったので、孤独対策をやろうと言って少しずつ、社会が動いてきたと思います。若者が自分の言いたいこととかやりたいことを言ったとしても、それが認められないっていうふうに言われてますけど、しっかり理由があって、そしてどういう社会を築いていきたいのかっていうビジョンを示すことができれば、学生であっても若者であっても、少しずつかもしれないけれども社会を動かしていけるというのは、この経験から学んだことですね。
May I thank Dr. Seki for sharing your insights and for providing all of us here a glimpse into what tomorrow's world could look like, not only a skilled world, but a world that is filled with the compassion that Koki spoke of in his video. And I think it's so wonderful because, many of these events that are hosted by international organizations like the UN sometimes have the community representative somewhere towards the back of the program. I know that this must have been a deliberate decision by all of you at the Western Pacific to really place and position Koki's story on behalf of us all in humanity up front and center, so that we can really understand the humanity before we start talking about the solutions and not the other way around. Koki's story is so inspiring in so many ways, and I'm so privileged that later on we'll get a chance to hear from him directly. Before we get started on that panel discussion, a quick introduction to us all. My name is James Chow. I'm a WHO Goodwill Ambassador for SDGs and Health, and I'm living in your region in the Western Pacific. And may I quickly introduce the speakers who will color our imagination today, starting with the Honourable Gregory Hunt, who is the Minister of Health and Aged Care of Australia. Mr. Hunt has been an elected member to the House of Representatives for Flinders, Victoria for exactly 10 years now, and he's been Minister of Health for 5 of those years. At the end of 2020, Mr. Hunt added responsibility for aged care to his portfolio and thus leads the government's response to the Aged Care Royal Commission. Prior to that, he was in ministerial portfolios taking care of the environment and also industry, innovation and science. To our speakers coming up now, you are up on screen, so please give us a wave as I introduce you so we can add a face to the color and the biography. Of course, Koki Ozora, whom we just met, the founder of A Place for You. He is also a university student at the Faculty of Policy Management at Keio University, where he majors in social safety policy. He's studying how to prevent suicide, child abuse, and domestic violence. He created A Place for You, a Tokyo-based 24-hour online support center with this vision, as I think you heard just there, so that we are not helped simply by the coincidence or the default as someone who comes into our life, but that there is a proper proper system of support and help as and when we need it. He wants to wipe out undesirable loneliness, and this community-based initiative is run entirely virtually by volunteers. So a quick wave there from Koki. And now to Beijing, where we are joined by Dr. Ma Ning, who is an attending psychiatrist and deputy director of the National Center for Mental Health of China, CDC. She is a dedicated researcher in mental health policy. She's led many projects that in turn have informed government policy, that in turn have impacted the lives of 1.4 billion people in the world's most populous country today. She says she's committed to promoting integrated mental health service models, not only in hospitals where, of course, it's needed, but really deep and far into the communities that we try to serve, and has much experience in culturing community-based peer support. Dr. Ma is very happy to see all of you here today. Let's go now to Japan, to Dr. Chio Fuji, who is the Director for Community Mental Health and Law at the National Institute for Mental Health. Dr. Fuji has many areas of important research, not limited to, but including mental health literacy that's implemented in school-based education, also adolescent mental health, schizophrenia, and community mental health. Then we go to a very different part of our wonderful region, to Kiribati, to Dr. Catherine Eiichi. She is a mental health advocate and a psychiatrist at Tungaru Central Hospital in Tarawa in Kiribati. Dr. Eiichi is also program manager of the mental health services, which consist of an inpatient ward and also an outpatient wellness center. So lots of really wonderful integrated approaches. And finally, Dr. Marco Luigi Corsi, who is the regional director for UNICEF East Asia and the Pacific region. He's based in Bangkok. He's been based there for almost a year now. And prior to that, he's been UNICEF representative in Mozambique and Bolivia, and has worked extensively across Southeast Asia and Western Pacific, and also Africa, Indonesia, Eritrea, Tanzania, Somalia, amongst them. We'll get on to Dr. Huong Tran of WHO, and I'll introduce her properly to you at the end of this session. But first of all, thank you to all the panelists for joining us today. And for our RCM delegates over there in Japan, joining us over Zoom also, we want to hear from you. So there's a chat function in the platform that you're using. I, as moderator, will try my very best to get to them either as a question, a comment, or an idea. So please put them in. And even if we don't get to them in totality, we can at least see them in openness and transparency, so we gauge what people are thinking as that conversation continues. Now, the COVID-19 pandemic has had a huge impact on mental health and well-being for everyone. It's affected some people much more than others, but I think it's fair to say that we're all impacted. So how can we refocus the mental health agenda, as Dr. Takeshi and Dr. Seki Eiichi outlined for us there, to give support in the pandemic, and also to include the well-being of everyone and ensure that we are reaching the unreached, whether we are in a pandemic or not. To share his thoughts on inclusion, equity, and the future of mental health, we're delighted to introduce now the Australian Minister of Health, Greg Hunt.
I want to thank Dr. Takeshi Kasai and the WHO Western Pacific region for hosting this important dialogue on the future of mental health and well-being. Much of the region continues to face the multitude of challenges associated with the COVID-19 pandemic, one of the most profound health crises our world has ever faced. At such a time, support for mental health is of paramount importance for all people in all countries of all ages. The shadow pandemic is mental health, driven by the toll this pandemic has taken on families and individuals affected by trauma, tragedy, economic loss, and simply the uncertainty that has been created. So therefore, the development of a new regional mental health framework will help ensure that strategies and programs for mental health reflect these new challenges. I would like to touch on three themes that are emerging as the regional framework is being developed. The first is reaching the unreached, an important principle and goal. If we are to design a system that can deliver the outcomes we want for all people, then vulnerable populations should be a major focus when developing mental health services. In Australia, this means developing services that support our Aboriginal and Torres Strait Islander peoples, those in rural and remote settings, our homeless, culturally and linguistically diverse communities, and our LGBTQI communities. For example, we've established suicide prevention networks and aftercare services for and led by Aboriginal and Torres Strait Islander Australians. We're also investing in early intervention supports and preventive measures for migrants and culturally and linguistically diverse people, and enhancing the cultural competence of the broader health workforce. Our second theme is embedding mental health into daily settings, making mental health support easily accessible for when and where people need them is important for the regional mental health framework. Given ongoing stigma and the reluctance of many people to seek help for even milder mental health issues, accessibility to services is a factor we absolutely need to get right. Services need to be accessible online and in communities where people live, learn and work, not just at emergency departments and dedicated health settings. And thirdly, we need to focus on transforming the mental health workforce. The capacity and the capability of the mental health workforce is fundamental to providing quality and compassionate care. Through our National Mental Health and Suicide Prevention Plan, Australia is making a significant investment to grow and upskill the mental health workforce. We are also progressing a national mental health workforce strategy to guide us in attracting, training and retaining the workforce we need to meet current and future demand. So then we have innovations in mental health care and digital technology. Australia in particular has seen changes over the 18 months that we've just been through that would otherwise have taken years. In particular, the delivery of mental health support through telehealth, through the telephone. Digital mental health services offer an effective alternative to higher cost and high intensity face-to-face services, particularly for people with common disorders that are less severe or who simply aren't able to confidently or easily move to see their doctor or mental health professional. This year, Australia made a substantial investment in the creation of a single world-class digital platform, our Head to Health website. This platform will provide online professional counselling, peer support, clinical support and referrals as part of our prevention and early intervention strategy. So then as we look at our vision of mental health, the Australian government is committed in heading towards zero suicide as an unshakable national goal and transforming the mental health system to ensure that all Australians can access the right care whenever and wherever they need. This year, the Australian government made a record investment in the National Mental Health and Suicide Prevention Plan. A substantial part of our investment is in treatment. The heart of our treatment reform is the creation of a national network of multidisciplinary mental health and treatment centres tailored variously to adults over 18, youth aged 12 to 25 and children up to 12 years of age. These services will operate under a no wrong door approach. That means that we can ensure that everyone is given appropriate treatment or referral regardless of where they enter the system. And so, as we move forward from the pandemic, we can start to embed and refine innovations such as telehealth in our healthcare services. The future of mental health depends on the application of interventions across the life course and better access to community-based mental health services. We have to increase the size of the mental health workforce and we need to continue to counter stigma and discrimination. We've made enormous progress, but there's more to go. And I look forward to the finalisation of the regional mental health framework. I'm sure the discussions of the panel members will help to shape such a framework, and that this will lift the collective vision of the region for addressing mental health. And for that, I honour you, I wish you well, I thank you, and I commend you.
Well, we thank Minister Hunt for his words, and we, of course, thank Australia for its leadership in health and in mental health. We're going to cross now to Koki Ozora in Japan, because Koki gave us that wonderful video. And Koki, we heard some of your story over there about reaching the unreached. How exactly do you do that? How do we become much more loving and skillful and impactful in our approach to promoting mental health, but also the well-being of all of us?
Well, thank you, James, and I also thank the Secretariat for having me here today and for the video too. And well, I believe that the technology offers tools that can reach people who fall outside the current mental health system, or simply find it difficult to share their thoughts and feelings even among their family or friends. And there's so much shame and stigma, very strong stigma associating with asking for help. And it is often seen as a sign of weakness or failure, and it prevents people who may need support the most from receiving it. And our trained volunteer counselors from all over the world help textures in distress by listening without judgment. And then about 20% of our volunteers are based outside Japan and can take calls from those who are desperate to reach someone late at night or in the early hours in Japan time. And we are not mental health professionals, but many textures express relief in being able to share their burden or feel comforted by knowing that there is still someone out there who cares about them. So, well, and help seeking is made much easier with the anonymity of web smartphone-based chat like us. And the hard to reach people can come forward to access this mode of contact using technology, or reduces the stigma. And also the act of writing out their situations and emotions often help them to work through their entangled issues, their personal issues. And then of course there are people who need mental health professionals interventions, but some chat texters say that they cannot get an appointment at all, while others hesitate going to clinics. So we have become one of the resources that people can turn to much more easily and then immediately. So that's my perspective.
It's really wonderful to hear and to see you with us as well. And not only being with us, but also helping to lead this side session. So you're very much, much more than just a participant. Our best wishes also to all of the volunteers who give up their time and who've been trained, as you say, doing this 24 hours a day, 7 days a week out of that office that we saw in the video over in Tokyo. And it's so interesting to hear you, Koki, talk about reaching the unreached, which we also heard Dr. Kasai and Dr. Seki use. When we talk about the SDGs, we keep on hearing about not letting those who are left behind. But I think this adds so much more of a human touch to this. Koki, I'm going to try and get back to you a little bit later, but I do want to bring into this conversation Dr. Ma Ning, if you could unmute your microphone as well. Dr. Ma Ning, as we said, is really one of the key figures for mental health in China today. And Dr. Ma, based on what you've seen in China for yourself, how do you think we should respond to that challenge? And would it be very different to what you've heard Koki say in a neighboring country like Japan, or is it very different from what you feel and see?
Thanks, James. It's my pleasure today to be here to participate in this panel. I want to say first, and I think the factors affecting mental health run through every stage of people's life. And therefore, we must provide a continuum of mental health services throughout the life course. In China, we run many nationwide programs for school students, pregnant women, and new mothers, and workforce, the elderly, and so on. These programs cover all provinces of China, both urban and rural, including some previously unreached remote places. Also, we are shifting our focus from treatment to prevention. Can you hear me? Can you hear me? Can you hear me, James?
This is better, I think. Dr. Ma, you were talking about how you're shifting the focus from treatment to prevention.
Yes, I'm going. Also, we are shifting our focus from treatment to prevention, and even earlier to mental health promotion, because mental health promotion and prevention enhances an individual's resilience to adversity and support their overall well-being. Such, for example, children who are mentally healthy and secure grow up, become well-adjusted adolescents and productive adults. In return, they are able to take care of their own children as well when the time comes. Realizing that in 2019, 12 ministries jointly launched an action determined created a favorable social environment for children and adolescents with multi-sectoral intervention. And more, if we want to provide a continuous of services, we need mix the human resources with different skill sets more than psychiatrists. In China in recent years, especially since COVID-19, I see many training programs organized, some to further develop the capacity of mental health professionals, some to equip general health workers with basic counseling skills, and some to provide self-adjustment skills to the public, especially the more exposed groups such as school teachers, media personnel, people with disabilities, government staff, and community workers. These trainings enabled them to be their own counselors, I think, to be better interact with others while performing work duties. In a peer support project, I heard the peer support from all of you. Yeah, in a peer support project I lead that covered 154 communities across 18 provinces in China, I saw that people with lived experience become active volunteers and provide peer support to others in their community. These volunteers of unique knowledge and expertise coming from a shared experience. If harnessed the right way, I think they can significantly expand our capacity and be involved in education, service delivery, and life skill training, and so on. This can be a strategy considered to expand the current resources to meet future needs, I think. That's all. Thank you.
Thank you very much, Dr. Ma. And just I'm going to recap the first point that you made, where we didn't hear you as clearly. Dr. Ma did say that the root causes and drivers of poor mental health evolves over the course of a lifetime, and thus we must provide a continuum of mental health services throughout that life course to enhance protective factors while also reducing risk factors. I'm delighted now to bring in Dr. Chio Fuji, who's over in Japan. Dr. Fuji, we heard earlier that you have a very broad range of very important research areas, and a continuum of services throughout the life course and volunteers are all great points. But what about you, from your perspective? How do you think we can best transform mental health care today?
Thank you, Jerome. I'm very happy to be here joining this very innovative side event. I think that the transformative, comprehensive, and person-centered approach to mental health care involves providing both healthcare and social services. Mental health issues cannot be adequately addressed by healthcare alone. The various difficulties of life would come together, leading to mental distress. employment, housing, education, and other social support assistance for the needy play an equal or even greater role than healthcare services in addressing mental health issues. I believe it is crucial to prevent isolation and loneliness, as demonstrated in Koki's video, promoting mental health first aid and enhancing mental health literacy would be key interventions and that facilitate informal mental health care and self-care. In Japan, we have been developing a community-based integrated care system for elderly people in a super aging society. By creating it, we have learned that it is important to help all people understand that getting old and developing dementia are not something special. Japan has trained dementia supporters, and there are currently about 13 million supporters nationwide. Similarly, training mental health supporters would be helpful in reducing isolation. Thank you.
We have this whole beautiful part of the world, which is the Pacific, which sometimes, you know, we look at the big countries and, you know, quite frankly, we don't think about everybody. But of course, here in the work of WHO at WIPRO, that very much is front and center. Co-creating the vision or the future of mental health ensures that this vision is relevant to the people of all the region. A shared vision implies a shared ownership of the mental health agenda. And as they say, there is no health without mental health, and mental health is all of our business. So how can we embed mental health into the journeys and the settings of daily life? As Koki said, it shouldn't be up to a teacher, a coincidence, a chance encounter that saves someone's life or improves someone's life. There needs to be a system in place. So let's go to our WHO colleague from the Pacific, Dr. Kathy Eiichi, who's over in Kiribati. She joins us from there. Dr. Kathy, over to you, please.
Thank you very much. First of all, our mental health team, we have a vision. It's a new vision for us, and that is not staying in the clinics, waiting for patients to come, but for us to go out to the community and do awareness, mental health awareness in the community. Community meetings and functions is a very important part of the village life in our islands. And so going out to do meetings face-to-face, giving our half-an-hour talk in the Maniera, which is a meeting house, will help us to interact with the people, to have feedback and questions from them. And this is very important because this is how we can give out the message on mental health well-being. Going out in the communities, we also we have done that during this year, and we've also done roadshow. We did that during the World Mental Health Awareness. We traveled on a truck with speakers and mics, and we traveled on the road into the communities. We stopped at different spots and then played the loud music for people to hear. And we asked them kindly if they could give 5 to 10 minutes to listen to our awareness. And not only through roadshow, but the social media, Facebook, and the radio awareness that we have in our country is part of our awareness. So we're targeting the main island, which is Tarawa, the capital. We have more than 50% of the population of Kiribati living on Tarawa, and Tarawa is overcrowded, and there are lots of houses and many people living in one house. And this is due to the migration from the outer islands to the main islands. And this is the contributing factor is climate change. Climate change has affected many of the outer islands, especially with the rising of sea level and the flooding of the islands, the low-lying islands, and people are not able to plant their food crops. The water is affected, the water supply. So people are coming to the main island to seek for education, jobs. And so that's the reason why it's so crowded. And if COVID-19 comes to our country, this will have a greater impact. and especially mental health issues will arise with overcrowding and all these problems with overcrowding and COVID-19 if it ever comes to a country. So it's so important for us as mental health staff workers to go out into the community and start talking to them how to manage their mental health, and stigma is a problem. People are not coming. So we don't want people to come to the mental health services because of stigma, but we want them to be able to take care of their mental health so they don't have to seek our services. So, I mean, mental health is everyone's business. So to make it everyone's business, we have to go out and talk with them so that it can be part of their daily life. They're able to take care of themselves. Another part is the schools. We should target the schools, but I will.
I mean, it was so interesting what you said there. I mean, there are obviously common strands beginning to form over here. We're talking about community. We're talking about reaching into people's lives in doing so. We're talking about school-age students as well. And I think it was so interesting what you said, Dr. Arite, about the linkage between not only mental health and COVID-19, but you hit the big issue that is shaping and reshaping our world, which is climate change and the linkages between that as well. We thank you very much for being such a great champion and mental health advocate. And of course, we wish you all the best for your work as a psychiatrist at Tungara Central Hospital over in Tarawa in Kiribati. All of our best wishes to you. As we also send them to Bangkok to Mr. Koki, who represents the work of UNICEF there. Mr. Koki, you know, we were thinking about your diverse experiences across the world, across the region. What do you think is the way forward for promoting the mental health and well-being of children and adolescents in the region, as we just heard there from Dr. Arite? And also, what's the role of partnerships in actually bringing this to reality?
Thank you, James, and good afternoon to all. Ensuring the mental well-being and health of children and young people is indeed fundamental to ensuring they can survive and thrive. With 1 in 7 adolescents diagnosed with a mental health disorder and one adolescent dying from suicide every 11 minutes, urgent action is needed. As we have heard today, a transformation is required to effectively deliver quality mental health care and psychosocial support for children and young people. There are 3 points that I would like to highlight. First, we need to collectively shift the emphasis from mental illness to the value of ensuring mental health and well-being to society and communities. Therefore, we must expand our efforts to create an enabling environment that enhances protective factors and reduce the risk factors across the life cycle of a child. And we must recognize the importance of resilience, empowerment, and social cohesion in mental well-being of young people and vice versa. Second, the overemphasis of diagnosis and treatment has not led to real impact for children. There is a need for a system of multi-tiered service for children and adolescents that can respond to the range of mental health issues facing children, as well as promotive and preventing interventions. Services must be tailored for children and young people. They must be made accessible to them in environments and on the platforms where they are and where they feel comfortable. And services must be relevant to the local context as well. And third, it must be recognized that the responsibility for delivery of these different service tiers falls beyond only the health sectors. Education, social welfare, and justice have indeed critical roles to play. UNICEF, in terms of partnership, is currently collaborating on a multi-country study with WHO in East Asia and the Pacific to explore how a multi-sectoral, multi-tier system can be implemented across different contexts. We have found that these sectors, especially in low-income contexts, often do not have workforce with sufficient numbers, knowledge, skills, capacity of resources to effectively deliver what they see as the core functions. Even fewer countries have workforces across those sectors with the capacity to deliver mental health and psychosocial support, which may be perceived as an add-on. And it will be essential to embed or integrate the provision of mental health into the system strengthening and workforce strengthening efforts, specifying mental health as a part of their mandate. Otherwise, it risks being left behind or left out. And as government increase overall investment in mental health, social welfare, education, and justice sectors must be seen as a critical for deliver on mental health and psychological support services and be included in the planning, budgeting, and resource allocation for mental health. If mental health continues to be seen as an add-on or rather than an essential role of sectors other than health, and if investment in mental health focuses exclusively on and predominantly on the health sectors, we will not see a transformation in the mental health and psychological support for children and young people. However, government cannot do this alone. Partnership between government, NGOs, and private sectors are critical, as well as with young people themselves. And during COVID-19, we have seen the power of peers-led mental health initiative. This brings me to the final shift we need to implement together. The sector has tended to shape programs and interventions through an expert top-down approach influenced by the medical approach to mental health. And it is critical that the perceptions, experiences, and views of children and young people are proactively sought, not only to better understand mental health among under 18s, but also the services they want and where and how they would like to access them. Meaningful participation of children and young people must be central to this strategic shift on mental health and is the cornerstone of a rights-based approach. Thank you, and over to you.
Thank you very much to Mr. Corsi for adding your words there. And can we pivot very quickly to Dr. Huong Tran, Director of the Division of Programs for Disease Control here at the World Health Organization. Dr. Huong, I'm very sorry, but we're squeezed into the last minute of the session. Please, over to you.
Thank you very much, James. It's really my very difficult task to sum up a very rich discussion and valuable perspective coming out from our session in such a very short time. So I'm sorry if I could not catch all of the good, excellent point, but I'm sure all the participants and honorable delegates already received a lot of valuable perspective and insight from the panelists. I also like to thank you to James for your excellent moderating role, and thank you so much for all our panelists who connected across 5 different points and time zones to share with us your perspective across the future of mental health. Your collective commitment to mental health alongside with pioneering, innovative, and impactful work that you are carrying out in your countries and communities are truly inspirational. The views and insights you shared today about the future of mental health also have illuminate the ways forward we co-create the future of mental health. As the side event comes to a close, the journey of co-creating the vision for the future of mental health continues. Over the past few days, we have listened to the intervention from our honorable ministers from Malaysia and Brunei and many other delegates on the critical importance of mental health and urgent call for action for the future of mental health in our region. We thank you so much for your leadership and your vision in driving this agenda forward. We also would like to express our special thanks to our Regional Director, Dr. Kasai, for your leadership and commitment to advancing the mental health and well-being. We are inspired by your challenge to address mental health in a more comprehensive and innovative way. In the coming months, we look forward to consulting each of our member states as we continue to shape this very important agenda. As our Regional Director mentioned during his opening remarks, our ambition is nothing short of transformative environment for mental health and well-being. Let's create the vision together and make that vision a reality. I would like to end our section today by reiterating that there is no health without mental health, and mental health is everyone's business. Thank you so much for your support and participation at our event.
Thank you, Dr. Huong, to all of our panelists, to all of our participants. As we call this the future of mental health, that means the work doesn't stop today. We merely have a point of renewal and a point of refocus, and the future of mental health continues after this. We'll shape that future together and work towards attaining the best for everyone in this region, and I hope through this region throughout the world. On behalf of everyone here at the WHO Regional Office for the Western Pacific Mental Health and Substance Use Unit, thank you for taking part, for giving us your time, for giving your skills, for giving your love, and good luck for the rest of this regional meeting.